Patty.
Yes. May is National Skin Cancer and Melanoma Awareness Month. Now, so it's the perfect time to educate ourselves on warning signs and how to spot melanoma.
And joining us now with more is Dr. Jordan Carcaville, founder of the Derm Institute of Chicago. Real quickly, before we get to the cancer talk, let's talk real quickly about this Vaseline. You just listened to us talk about the Vaseline on the eyelids. Is that a good idea? No.
I think it's good if you have sensitive skin, but you mentioned you can get clogging of some of the ducts.
Okay.
So some people might get like little milia or a sty. So just be careful.
Yeah, the sty is not good. It hurts. All right, now we can get into the melanoma. This came up because a lot of people are probably going to start shedding the clothing this week, in fact, and they might notice a little spot here or there.
Yeah.
I've noticed a few. How do we know if that's skin cancer or not?
So there's a lot of different things that we can look at. There's melanoma and non-melanoma skin cancers, but if there's ever a question, you want to ask your board-certified dermatologist.
Okay.
This is Melanoma Awareness Month, as you guys had mentioned earlier, and skin cancer is the most common form of cancer, and it affects all skin types. 1 in 5 Americans will be diagnosed with a skin cancer by the age of 70.
Whoa. Oh my goodness. Whoa, and it's serious.
Yeah, absolutely. And
Can be.
And you were also saying that it doesn't necessarily show up on parts of your skin that's exposed to sunlight.
Correct. So I think the statistic is about 65 to 70% on skin of color. Melanomas can occur on acral surfaces, which are hands, feet, and nails.
Wow. Okay.
So it doesn't always have to be sun exposed.
Okay, so a lot of people worry when they go get their manicures because they're sticking it into those machines that are supposed to cure. Can that cause cancer?
So it's not UV, so it's typically just light. So it's low risk.
Okay.
Okay, so what are some of the signs that we need to look for in the spots?
So I did bring this card today, so you guys each have a copy.
Okay.
But for melanoma specifically, we look for the A, B, C, D, E's of melanoma.
Okay.
And so asymmetry, border irregularity, color variability, diameter, meaning size greater than 6 millimeters. And the most important to me is E, which is evolution. So if you have a mole or growth that's changing, definitely get it checked out.
Okay, go ahead.
Oh, how are you supposed to remember what your moles looked like a while ago and what's changed?
Surveillance is good, so people can look at their own skin at home, and we as dermatologists are happy to look at you yearly. People who should get a yearly skin exam are those that maybe have had a history of a lot of blistering sunburns, a personal or family history of skin cancer, light skin, light eyes. Those are sort of risk factors that we recommend you to get checked.
All right, so we don't want to scare everybody at home, so we're going to warn you that some of the photos that we're about to show can be a little disturbing, but you're saying that there's different levels of skin cancer.
There's 2 main categories of skin cancer. So there's the non-melanoma types, and then there's the melanoma types.
Okay.
The non-melanoma types are squamous cell carcinoma, basal cell carcinoma, and here it shows Merkel, which is less common. But these originate from the upper layers of the skin, and they present as scaly pink bumps. Maybe they look like a pimple that doesn't heal. They can appear a little darker, than pink on skin of color. But those are non-melanoma, and they grow slowly. They're less aggressive and less chance of it metastasizing.
Okay.
A melanoma originates from the cells that give our skin its pigment, and those can be aggressive. So we need to check moles regularly if someone's at risk.
So when you say your dermatologists are happy to look at this, what do you call? You say, hey, I just want to do a skin cancer check, or how does that all happen?
So you can call a dermatology practice and just request a skin cancer screening. Sometimes primary care doctors will make a referral, but it's pretty much just a phone call and scheduling an appointment. It's very routine for us.
Oh my goodness. I mean, it seems like such a small thing, but I mean, there's lots of things you can do day to day that can prevent something like this happening, and it can be fatal, right? So what should we do every day?
So you want to protect yourself, protect your skin. So I actually just raided my closet at home. So there's different, so you want to wear hats and you want to wear sunscreens.
Sunscreens here.
Sunscreens over there. So broad spectrum, SPF 50 and above, and reapplying every 90 minutes. I always wear what are those, surf shirts just at the beach. Just
More
'cause
coverage.
It's more coverage. It's easier than sunscreen for me.
And then you got different hats with different brim sizes.
Yes, these are literally from my closet. So if I'm walking around, they're all at least 3-inch brims. So I like, you know, a 3-inch one if we're just walking around so the wind doesn't blow it off. If you're at the beach, this one's huge, so I love that one. And then just a medium size. But
All right, you have a gala coming up.
yes, so this is so exciting. This is like, I'm so passionate about it and excited to share with you. So June 10th, so it's about a month away, it's called the Art of Skin Gala. It's hosted by Chicago Derm Society. I am the president of the society this year, so this has been my huge project all year. It is open to the public, and it is a celebration of all skin is beautiful. It's about inclusivity, and it's coming from the experts of skin who know that all skin is equal under the microscope, and it is just going to be a glorious celebration. The proceeds are going towards children of Chicago from underserved communities of color, supporting their education in STEM. One of my real big goals was to help decrease the healthcare disparities and help kids get science education at a young age. And then the other component is that we're starting dermatology mentorship program for medical students of diverse backgrounds. So this is the first year we've ever done it, and I'm so excited. So please come, look at our website.
We can tell. Dr. Carcaville, thank you for coming in, answering our
Thank you.
questions, and sharing this information with us. It's
you.
so important.
Thank
All
you.
right, we saw the information there, so everybody try to come out and enjoy yourself.